Welcome back to you. Max has now magically rejoined me here in our actual studio. You're now going to moderate this next session on medtech and services. What was the thinking behind it?
Well, the thinking behind it is really that medtech and its role is changing quite fast. And medtech's now offering much more complex platforms which take it into the realm of clinical pathways and very much more into the actual delivery of healthcare and away from the supply of single items of equipment. And so that really means that the relationship between medtech and its customers is set to change. And so I thought it'd be interesting to look at that in this session.
Okay, Max, thank you so much. I shall leave you to introduce the panel. Thank you.
Okay, thank you. Thank you, Sharon. Thanks, and I'm pleased to be joined once again by Martin Brunninger, Austria's Director General of Health and Social Care, by Catherine Estromp, President and Chief Executive of GE Healthcare EMEA, João Sebra, who is the President and Global Head of Enterprise Services at Siemens Healthineers, and Frederik Ragmark, who's the Chief Executive of Medicover. So Frederik is here as a provider, somebody who runs hospitals and has large outpatient networks which are sometimes supplied and met by people like Siemens and GE. And I guess Martin is here in a sense as a government, which in fact he is. So, well, I thought that the conversation would be good if we actually just briefly looked at what the new medtech platforms are that these companies are suggesting, and then go into discussion about how it changes the relationship between medtech and providers. So let's start off ladies first. So let's go to Catherine. So Catherine, okay, over to you.
Good afternoon, everybody. Delighted to be with you. If you could show the first slide, please. So 2020 has really been a year of immeasurable changes and has
Have we got a problem?
while facing equipment, shortages.
Okay.
And capacities. The only was step up, accelerate innovation. Let me give you two examples. One on here. Problem?
There is a problem, actually, Catherine. We've got a very poor connection to you, I'm afraid. I'm not sure what to do in these circumstances. It's come back now. Let's try again now, Catherine. And if this doesn't work, we might let the gentleman go first and the lady second. So over to you, Catherine, again.
Perfect. So what I was, saying, can you hear me now?
Yes, we can.
Okay,
very
perfect.
Clearly.
So 2020 has been a year of immense, immeasurable change, and has pushed many healthcare providers, to the brink. I know that everybody knows that. And all around, the world, doctors and nurses have been battling the virus while facing shortages from an equipment, perspective, but also capacity issues. So from a GE, perspective, the only response was to really step up and accelerate innovation. And the first example I wanted to share with you on this first slide is our command center, which is essentially an AI tool to improve out and efficiency from a hospital operations perspective. It is now used in more than 200 hospitals around the world. And in essence, what it can do is really help you find an empty bed at 3 a.m. in the without the need to call the wards. And it can really direct the resources towards the areas of high need to best care of the patients. And during COVID-19, it was an extremely important tool for us to work and to support our clients as they were trying to separate COVID-19 patients from non-COVID-19 patients. And I have an interesting example for you. In Florida, the Tampa General installed its first command center in 2018, and they cut the length of stay by a day, and they have been adding the equivalent of 30 beds of additional capacity. But more interestingly, and during COVID-19, they are now collaborating with the health systems across Florida in order to use this technology to manage the state's bed, if you would like, capacity during COVID-19. If you go to the next slide, the second example, briefly, I wanted to share with you of those new services is called Mural, and basically it's a virtual care solutions that integrates data from multiple system and devices in a department in a single pane of glass, which you can see here on the screen, to provide real-time comprehensive view of a patient's status in an ICU or across a department. Again, during COVID, it was extremely important because it really allowed clinicians to remotely view real-time ventilated patients and really help identify those at risk of quick deterioration. So these are only two examples of those new services. COVID has accelerated the shift in healthcare system to improve workflow and productivity. We had started investing in that a long time ago, and now going into 2021, we are definitely doubling down.
Thank you very much, Catherine. That was great. Okay, thank you. And so, Wow, do you want to just show us what Siemens is doing here?
Absolutely, Max. Thanks for the invitation. It's a great pleasure to be here. And hello to my panel fellows as well. And as you mentioned, and we can move directly to the next slide, please. Max, the way we see it, the role of the medtech industry has been changing over the past, and I think it would be interesting that we would start the discussion basically about the why. Why is our companies like Siemens Healthineers, but Catherine just explained what she is doing, and we see many other medtech companies actually going in the same direction. And I think that we all agree that, and for most of us that are on the healthcare industry since a long time ago, one of the things that really has been accelerating over the last few years is the pace of innovation. And as I assisted this conference since yesterday, and I like very much one of the first discussions for Pingen and Teladoc is how technology adoption is actually driving as well quality into healthcare, and is helping healthcare providers around the world to manage the burden of disease and actually to reduce the costs as well. But the fact is that as the pace of technology accelerates and technology becomes more complex, I would say, the adoption of technology is not easy, neither linear as well. And we see lots of customers around the world saying, well, for us, it's not about you fulfilling specs anymore. So it's not about how you can deliver the latest and the greatest CT scanner or MRI or the latest analyzer for the lab. It's basically about how can you help us to deal with the challenges that we have. So the needs that we are seeing from our customers from the world around the world are becoming much more complex. And so what we need to realize is that, in fact, that as there is scarcity for staffing and there is the need for or increased demand for healthcare services, the era for personalized medicine is here. The AI is becoming clearly a reality as well. So how can we help healthcare providers actually to get access to this technology? And how can we make sure that actually the adoption is exactly what we can expect also from the technology as well? And that's exactly how companies like Siemens Healthineers came to the services space. How can we help healthcare providers actually to deal with the access to technology on one hand, and how to deal exactly on how to use technology in a very efficient way? And the way that we believe that we can deliver value to our customers, it's what you see over there in the slide. We believe that those are, on one hand, key needs and challenges from our customers, but this is exactly the way that we, as Siemens Healthineers, commit to deliver value in healthcare, expanding precision medicine, transforming care delivery, improving patient experience, and digitalizing healthcare. Those are clear topics for Siemens Healthineers. But as we can easily understand, those topics are not things that we can easily achieve just through the means of technology on one hand, and it's not something that we can actually achieve just by delivering technology to our customers. So in order to achieve most of these topics over there, we need to understand that this is a marathon. This requires actually that different players collaborate, and in essence, we also know that healthcare is a team sport. So this is not something that we can individually alone, healthcare providers alone can deal with this anymore. And that's how we came to this, on one hand, the need to actually bundle technology with different value-added services, consulting, education, digital platforms. And on the other hand, to come to what you also mentioned, Max, at the beginning, which is the way that we engage with our customers to deliver those services also needs to change as well. It's not so much about engaging in transactions, single transactions with our customers, but it's actually about partnering with our customers for the long run. And on the next slide, that's exactly what we depict. The way that we do that because we want to optimize exactly how our customers are utilizing technology. And that, for them, it's really about getting the most out of the technology and the innovation that companies like Siemens Healthineers provide to them. So how can we look into current operations and increase the output, increase the outcome, and trying to reduce costs as well, of course, expanding capabilities, in expanding facilities capacity on these facilities as well, and advancing, which is basically closing the gap with innovation and making sure that we support our customers through these innovation cycles in a way that they also have possibilities to get the latest and the greatest in terms of what innovation it's able to provide. And we do that on the left-hand side. What you see is that we do that across multiple elements. So it's a very modular approach, and everything that we do is actually very much around technology management. That's how we start. And in general, as we talk about services, I think that it's a bit of an abusive way of using the term, because what we do, I think that it's really about technology-enabled services. So it's not about services in the general sense of the word. And we have healthcare services providers as part of this panel as well. But it's very much around technology. And then, as I mentioned just a while ago, how do we bring other elements that will drive those three aspects that we see on the right-hand side. So it's about bundling this with consulting, transformation, digital elements, the way that we help our customers to deal with the complexity of data, the adoption of artificial intelligence, but also how do we help our customers to better deal with the operations and how they run the fleets. And also a very interesting aspect, which we that is a clear added value to our customers as well, is how they and it's frequent that they reach out to us asking how the other of our customers actually solve exactly the same problems in different parts of the world. So this access to knowledge is something that companies, global companies like Siemens Healthineers, can support as well. And in the next slide, just to conclude on this, some examples of how do we actually drive this. And you see here very concrete examples of outcome, and this could be measured in different aspects of benefits. You see on one hand clinical benefits, you see operational benefits, and you see financial benefits as well. And looking into this topic around how can we improve pathways, you see that actually most of these partnerships actually go very much and more, I would say, very much in the direction of how technology supports more efficient pathways, how technology supports better throughput, but also much better outcome. You see a clear example of that over there, where in Rush University Medical Center in the US, we actually improve the door-to-needle time by 27%, which clearly has a very strong impact on the patient's survival rates. So this is, in a nutshell, what Siemens Healthineers is doing, and happy to start the conversation, Max. Back to you.
Fine, thank you very much, Val. So, Frederick, how do you see these new? I mean, this basically means, I guess, much closer engagement and much bigger platforms. Does that worry you, or what's your feeling when you're approached by people like Siemens or GE on this kind of product?
Yeah, no, well, I mean, it certainly does not worry me. I think it's I think the challenges that we are up against across the healthcare industry is so large that I think we need to find practical partnerships and how to deal with it. So, the way I just wanted to quickly, because I think we have, quite a few sort of interesting setups like it. And I think one way, perhaps from a provider side, just of describing how we think about it, and I think it's quite a bit, where I mean, if I look at basically two dimensions, and one is looking at, where does the additional value come from? Is it from the technology itself, or is it from the actually medical staff using the technology? If that is one dimension, and then the other dimension you can look at is this a complete solution, or is it a partial solution that fits into something else bigger in totality? And then I think if you look at it in those two dimensions, then I think you get the sort of balance of power between the if you wish, the provider and the technology partner. And
Yes.
in some situations, I mean, you can come up with different examples in these four boxes. But I think the point I'm trying to make with this is that clearly, we will never become a technology company, and rarely will big technology companies become service organizations. So I guess the kind of thing we're talking about in this session now is it value creating to get closer to one another, which I truly think it is. But then I think it's sort of important to define it, not necessarily in the dimensions I did now, but you see where is the value created, and how do you then sort of set up your partnership to reflect that fact. So that was my
Right.
starting point I wanted to bring in.
Right, the idea of value and how you reflect that value in the deal you do and the relationship you hold. Martin, what do you think?
Can I be honest and open?
Yeah, well, yeah, that's why you're here.
Right. Okay. So one story that I would like to open up my comments is a very, very dear friend of mine. He was a neurosurgeon. He is a neurosurgeon. He took me to one of the operating rooms to demonstrate something to me. And the operating room is obviously the heart of a hospital where the most the value is generated. And before he took me to the operating room, he took me into the cockpit of a 380. And he demonstrated two things. The 380 is almost as complex as an operating room. There's lots of technology coming together from different providers. You have a higher level of passenger safety and compliance, etc. So very comparable to healthcare. Then we have seen one interface. Because the pilot looks at everything in the cockpit in one interface, where everything comes together. And he took me to his operating room. Do you know how many interfaces we counted there? 52 interfaces we've counted in the hospital from 48 different providers, and those 52 interfaces have to be operated from a team of 5. You imagine how many hazards he's expecting every year just because there's human mistakes being made in operating these interfaces. So I think what I want to say with that, one of the biggest problems we have in hospitals and in healthcare is that these systems, they're still not connected to each other, don't communicate. I would be quite keen to understand from the two medtech companies presenting here, how would they create an open system that the hospital really benefits from it, and do not close another data silo where only Siemens or GE or Philips machines can communicate with each other. I think that would be a real.
What do you mean by, when you say open system? What do you mean? Can you define an open system?
Well, if you create a system that captures data, processes data, and then you can apply obviously AI, because there's terabyte of data that we throw away every day in an operating room that has not been collected and not been processed, and that is because it's only partly useful. because those data become useful when they are connected. You have obviously anesthesia machine, you have an operating table, you have a light, you have an endoscopy, you have a C-arm, you have a robot, you have tons of different things that work together, and they capture data. And I think those data could be extremely valuable in avoiding costs, unforeseeable problems in the operating room, signals that have been captured that have never been properly processed and analyzed. So there's an awful lot of value that we can create if an open system would be introduced where all these interfaces and these individual machines can talk to each other, and we can make sense of those data that have been created. I think that's still a problem in healthcare, and would be quite keen to understand how the big
Right.
players would
So you
come
want
across that.
a more integrated and open platform, in fact.
Yeah.
Catherine,
That
do you
would-
want to address that question of the fragmentation there?
Yeah, no, it's a great point. This data, fragmentation, and as we think about, one of the effects of the COVID-19 is that we see healthcare, systems using analytics data to gain access to real-time data that illustrates, hospital and resource capacity. And in the two examples that I presented, to you, whether it is the command center or Mural, but we have other digital, solutions who actually take input and images and the signals from any vendor, related, if you would like, technology. So it's not proprietary GE technology, related data acceptance only. And so the goal, for us is to continue to work in that ecosystem and to put digital, solutions like the ones I shared, to actually connect data coming from various vendors and OEMs. Absolutely.
Is that what Edison is doing with imaging, for example?
That is what Edison is doing. The Edison platform is actually a collaboration platform for the development of a software application, whether clinical or operational, with the participation of healthcare providers who do not necessarily be GE customers, but also startups and governments.
So you're saying you're in favour of open systems and consolidating
Absolutely.
open systems like that.
Yeah.
Let's hear from Yao, and then go back maybe to Martin and see what he thinks about that. Yao, I mean, this problem of the fragmentation, I suppose this is what you're actually addressing, isn't it? What you're trying to address, effectively.
Yeah, so this is, I can only echo the fact that this is one of the holy grails, I would say, within the healthcare environment. Very fortunate, I would say, that, and here GE, I believe it's on the same level in terms of what we do is very regulated, in particular on the imaging side, since years that DICOM has regulated exactly how do we share information. There are no proprietary platforms anymore from that standpoint. What we've been doing over the years is actually that we are increasing the openness of those platforms and actually developing ecosystems that host many different players, even not only different platforms but also players, and everything is integrated from that standpoint. I think that here the challenge is it's easy to integrate the data layer. It's easy to integrate the logic part of that. I don't want to be too technical, but what is difficult is actually exactly how do you deal with the integration, with the semantics part, which is the layer that you put on the top. It's exactly where the difficulty lies. These are topics, and Katri presented those examples with the Command Center. We could present team play as well as exactly the way that companies like Siemens Healthineers deal with the complexity across the system, to bring across many different data lakes, so that information actually can make sense, to a healthcare provider that actually needs to make a decision, a therapeutical decision.
Right. So they're all in favour of this move that you're suggesting, Martin, and you are particularly keen that the state should basically own any patient data that is created, are you not? You're particularly keen that the Austrian state should have effectively own the data and be able to integrate it across all platforms.
No, I think it's not so much that I suggest the state should own it, because the patients really they own the data.
Okay.
In Austria, at least, it's the legislation, and they're represented by the state, of course. But I think what the main point I would like to want to bring across is to have a uniform system. I mean, I have to admit that outpatient and inpatient with data, with capturing data, they don't need necessarily be totally connected. It would be good to understand, obviously, discharging patients and what has been going on in hospital. But when we talk about the operating room, what's going on in there, I think there is important, I guess, that all these systems and these interfaces, they communicate with each other. As well, it is important that in the outpatient setting, with the electronic health record, that all the information that's been captured by doctors and by labs or radiology institutes, etc., that all this data are on a central system where all the data from a single patient are available to any healthcare provider. But that would make, I think, a virtual clinic and a virtual treatment much more reality. And that's, I think, what really the point is: who owns it and who doesn't own it. The more likely owner is probably the state, because that's the most common denominator. If it would be a reliable partner, but I'm just a bit skeptical that that companies who are really good in developing devices or drugs or any of these things suddenly become data capturer, because they only create a bigger problem, because they just create another data silo,
Right.
and this is not really benefiting the healthcare progress, in my view.
Do you also worry about this, Frederick, or is it a bit not really on your agenda that much, the whole notion of who owns the data and whether the data is fragmented like that?
Yeah, well, I mean, our whole raison d'être is our integrated model. So, I mean, I mean, where we run the insurer side and the provider side. So, I mean, I'm a very, very large supporter of integrated data. I have a tremendous amount of respect for trying to make healthcare systems talking to each other across the public sphere. I'm in Stockholm here now, and then here is incredible data disintegration in the healthcare system. So I have a great deal of
Really?
respect for that challenge. But I share the view that somehow finding the ways to share data. I mean, that's really the way I think we will be able to gain insights in an important way. One point I wanted to make, Max, is if we look at this terrible year 2020 that we soon have behind us, but in terms of
Yes.
the incredible struggles and hardship all medical staff have faced across the world, and certainly in our Medicover world as well, and not the least out in India, with an just incredible amount of COVID admissions in our hospitals there, and the improvements that have been able to be made within a relatively short period of time with the help of technology, and help actually to some extent of actually artificial intelligence to move from a not purely but very largely physical care delivery world into a much more virtual and digital. That has just been a tremendous thing for us, which had not been possible had not some of these partnerships been set up ahead of time, although no one expected the COVID-19 crisis. But I can only voice how much care we have been able to deliver that otherwise would not have happened had this sort of technology platforms not been in place when this year started. So I'm very,
Right.
very supportive.
So you're very supportive of them. So
Yeah.
going back to you, Catherine, I mean, this question of data. Let's look at that for a second. I mean, people always talk about Google, don't they? And they say that Google, collects all this data and stores the data and then has the data, and the model for a consumer like me is, of course, that it's free to use, but they're getting the data. So how does GE view medical data? Do you view it as a significant asset which you're building up yourselves internally, or how far do you think that data should be free and reside with I don't know, with the state or with the operator? I mean, how do you feel about data sharing in the way that Martin was talking about? Catherine, I think we've lost you. Okay. So, yeah, what's the same question to you, really? Is data an asset for Siemens, or is it something you're willing to share? I mean, when do you share it, when do you not share it?
I need to say that obviously data is an asset today, not only for Siemens Healthineers, but for any other company that operates not only on the healthcare environment, but I would say across the industry. People say now data is the new currency, right? That it's not possible to continue to advance innovation without data. And that's
Yes.
Obviously we need data. We are using data to to drive continuous innovation, and a clear example of that is the developments on the AI field. It's not possible to think about how can we continue to drive forward artificial intelligence without data. Basically, artificial intelligence is fed by data. But I would say it's a virtuous cycle. I don't see it. I fully agree with Martin in the sense that ultimately the patient owns the data. I ultimately agree as well that we should not build multiple silos of data. But it's important that we all acknowledge that, in fact, to advance innovation, and in particular in this area of healthcare, and I believe that. I hope that we are in agreement that the utilization of artificial intelligence in medicine might bring very relevant benefits in a time where there is scarcity for very skilled resources. There is the need to improve throughput. There is the need to get to provide access to more population. And one of the ways to do that is actually that we use AI to further support healthcare providers. So it's not basically, and there is, of course, always this discussion about, are we replacing doctors? Are we replacing healthcare providers?
No.
Of course not, but it's basically about providing very efficient tools that can help healthcare providers to make not only better decisions, but ultimately to do more with the same resources. And
Yes.
data is essential to do all of that.
So data that you are collecting in your machines, you're happy to make it available to other people or to your customer?
Well, actually, the data is not ours. The data is our customers, and eventually
Okay.
they will allow us to get access to that data.
Okay, fine. And I guess, Catherine, you share that approach. I'm sorry, you're having terrible trouble with your link, aren't you? Okay, fine. Fine. So I mean, I guess, Frederick, when I look at the large medtech companies, I mean, particularly in, say, the lab space, you see this move from selling a particular machine to selling a whole system to selling a platform to a lab. And then I guess that if I was a big lab operator, I would think, oh my God, so I've got to choose now for the next 10 years which of these sessions I want. Maybe I'm going to lose some of my value add because these machines are going to, this new platform is going to be so clever, and I have to decide which technical platform to go with. And I'm not sure I want to make that decision. And the decision I'm going to make is going to be maybe a 10-year one. So the sales cycle, the size of the commitment and the length of time it takes me to make the move are both going up. So at one level, I suppose I might feel a bit nostalgic for the old days when I'd just buy individual product items. But I mean, no, or do you feel that nostalgia, or does this doesn't worry you at all?
Well, no, I don't think I feel the nostalgia, Max, but I think it's it's an inevitable. See, I would sort of turn that coin around and say, I mean, one example that we spend some time, or quite a bit of time actually, on is digital pathology. I think that's one interesting example just in our world, because I think that's one of the most acute shortages in specialists, high-end specialists in I guess all of Europe, and certainly Western Europe, and we have quite a few such people working in our network, and how we can take modern technology and connect them to care sites in other parts of Europe where that scarcity is so significant. You can say, well, sort of we certainly end up I'm not going to say who we work with on this call, but it's we clearly get a bit married, so to speak, to the partner we work with. But on the other hand, we solve the problem that you base it or challenge. You can't sort of solve any other way, I think. So while perhaps sometimes history is nice to look back at, but somehow the pace of change and the requirement, I think we're all up, certainly as a provider. Our biggest challenge with a factor 10 is the ability to source our staff requirements, because the pool of medical people to recruit is just getting more and more shallow, and cost is going up. So
So any solution which
relative importance
yeah.
of being able to augment your staff and your professional skills with new technology is just increasing all the time. So
Yes.
perhaps that is more the issue than the sort of how it used to be yesterday.
Yes, so it's much more about the people, sourcing the people rather than the equipment. Right. Yes, I see what you're saying.
Or perhaps using equipment technology to augment the people you have.
Yes, and that's something that's happening now more and more, isn't it, Catherine?
Completely, and I hope that you can hear me now. I'm sorry
I
for the
can.
technology issues. Good. Yes, so I think that this is back to AI embedded into the devices. To some example would be and that's across the industry, right? Example could be faster patient positioning, which is easy when we talk about it, but actually it can be difficult. Automated selection of protocols to again optimize the way to deal with the patient, and then faster reconstruction powered by AI models. So again, this is really to make sure that we are supporting with the efficiency and the productivity focus that our clients need, in part because of the workload, and also because of the lack of the shortage of personnel. So we at RSNA, just as an example, Max, and for your audience, we introduced in MR something called a software called Air Recondier, which is basically a AI-powered reconstruction model that basically cuts the reconstruction time by 30% with the same image quality. So as you can imagine, in a world where reimbursements are struggling and revenues have been going down over the past few months, for our clients, having access to tools, decision-making tools that are allowing them to gain inefficiencies is becoming more and more critical.
Right. Okay. Thank you. So this means all this means a much closer relationship then. What we seem to be saying is that you're happy to have this closer relationship, Martin and Frederick, with people like GE and Siemens. So what does that really mean, Martin? Do you have a clear idea of what that closer relationship would look like, or what that partnership would look like, or what? I mean, there's always conflict in a relationship, isn't there? Although I'm struggling to find any conflict at all between any of you.
No,
Martin.
I think what we need to to identify a few things in healthcare, because I think a lot of people will agree that we are very good in treating complex operations and problems. We can get better at that for sure, but that's not really where the avoidable costs are there, and where we can improve a lot. We can improve on two things. First is to find where processes that we know how they should run in a perfect way, why aren't they run in a proper way? So those are the avoidable costs, to make those processes run the way how they should run. That's one, and I think their data and process engineering and digitalization can help a lot, both in the outpatient and the inpatient setting. The other big thing is, and that's where we're talking about communicating data, where we can learn things from data that we don't already know. For example, picking up on signals that aren't really related to any outcomes, which can be read in a medical textbook. because it's simply not known yet. And I think those are the interesting things where we can also avoid costs to learn new things in medical science from data. And there, I think the system needs to communicate and amalgamate the data that we capture every day. And I think it's a question, I guess, what is a fear from a lot of operators when we talk about AI. AI is just a simple machine. The AI needs obviously to have a data set where it can learn from. And what is missing in healthcare, one of the biggest problem is what's easy, because if you teach an AI machine to differentiate between a cat and a dog, a picture, you give him thousands of cat photos and thousands of dog photos, and then at some point it will learn to differentiate because it has a feedback cycle. It knows what's wrong and what's right. In healthcare, the feedback cycle don't really work that well because very few doctors will admit that they are wrong. So the AI systems find it difficult to learn. So this is something that a problem that we have to tackle with the operators like Siemens, Philips, or GE here, because those we can read those feedback cycles that we do not have the input from doctors. We can learn it from the machines where the data are captured. That would be a real improvement.
So, sorry, I'm very stupid. What do you mean when you say that the doctors don't? So you've got to be able to say it's a dog or a cat, and it's always a cat. With what do you mean?
No, it's just the principle when an AI to create an algorithm. When you want to teach an algorithm to differentiate between a picture, is it a cat or a dog, and you want to teach them, and you give them a data set to learn from. So you give them 1,000 dog pictures and 1,000 cat pictures, and you always give when it picks a cat and it thinks it's a dog, you say it's wrong. When it picks a cat and it thinks it's a cat, you say it's right. So from these steps, the algorithm learns. So you need this positive and negative feedback cycle. So you teach the algorithm to get smarter. And that feedback cycle in healthcare is very difficult, because for the feedback cycle, you need to admit that a doctor needs to admit that he was wrong, or we need to prove him wrong so that the system can learn. Right? You see, that's the problem, because if you see how in the hospitals the data capturing is happening, it's usually done by the junior doctors at the end of a very long day, and then it basically puts in the information that he puts on or she puts on yellow post-its, and totally wrecked by the end of the day. The young doctor is putting it into the system. You can imagine how correct the data are and what the quality of the data is. So I think this type of things has to improve to capture real world data, and I think they're the system providers here in this group. They can really help to open up the systems that
by finding that data.
Yeah, yes. Exactly.
So you are really looking around the world for that kind of data, are you, at GE, Katrin?
Yeah, but I think that the point that was just made is an excellent one, because it's really about that trustworthy AI based on clean, data, annotated data, and the EU has issued, some very specific rules when it comes to the management and the collection of the data, and we are obviously part of those rules. I think it brings a second question, which is that no company can really solve this one alone, and we believe in bringing into the ecosystem, leveraging the strengths of the clinicians, of the technology partners, being big companies, startups, academics, and others, to develop and integrate AI or deep machine learning tools, which was referred to, and start analytics and development of software from those trustworthy data. Yeah, absolutely.
Yes. Okay, thank you. And yeah, so what you've heard today, I guess, is what you were expecting to hear, in a sense, from Martin and Frederick.
Yes, absolutely. Yeah. Absolutely aligned.
Yes. And you Yao, any thoughts?
Well, not to repeat what Catherine just mentioned, and I think that from that standpoint, in terms of how do we use data and the need to use data, and I think that we are all in violent agreement. Where I would like to say some final words is probably around this topic that you mentioned, Max, about these long-term engagements with our customers. So of course, that when you are in a relationship that lasts for 10, 20 years, there are ups and downs. But what is important from our view as well is that there are incentives and objectives which are clearly aligned, right? So we cannot get into these partnerships, long-term partnerships, without having a clear understanding about what we want to get out of that relationship from both parts. And actually, it's like you are in a marriage, and you need to to make sure that those objectives align, and that you also put incentives in place. This cannot be about one party getting the benefit and while the other is not getting the benefit. So it's really about putting some skin in the game as well. We are used to do that, because we believe that actually what we are doing in terms of those engagements and these engagements being able to make to drive healthcare from forward, to really enable healthcare providers to drive performance improvement.
Yes.
and the like. And that's why we are not afraid of putting skin in the game and actually going into these performance relationships.
Okay, fine. Good. Well, thank you very much, panel. We've come to the end. I think we've kicked it around nicely. So thank you very much for your time and for your input. Thank you. Goodbye.
Thank you.
Thank you,
Bye-bye.
Thank you so much, Max, and thank you so much to all the panel there for joining us. Thank you. Please do remember to give feedback on that last session. Don't forget you can just click on the session and then on the green link. So we are now straight into the next group of roundtables. You've got a choice of 3 here. Transforming Healthcare with AI, led by McKinsey and EIT Health, hospitals, and how to leverage social media in healthcare. So we will see you back here at 4:15. See you then. Thank you.
Okay, thank you.